Hello and welcome to the topic Major Depressive Disorders in the Psychiatry module. By the end of this session, you should be able to define major depressive disorders, explain the classification and subcategories of major depressive disorders, discuss the pathophysiology and causes of major depressive disorders, understand the clinical manifestation and recognize them, list out the investigations for diagnosis of major depressive disorder, and discuss the management approach to major depressive disorders. So let's get started. Major depressive disorder, or MDD, also known simply as depression, is a mental state illness that is characterized by at least 2 weeks of pervasive low mood. Here, we often come across terms like low self-esteem, loss of interest in normally enjoyable activities, low energy, and pain without a clear cause, which is a common symptom. Those affected may also occasionally have delusions or hallucinations. So, how does the DSM-5 classify depressive disorders? Well, the classification is as shown in this slide, where we can classify them into disruptive mood dysregulation disorder, major depressive disorder, persistent depressive disorder, premenstrual dysphoric disorder, and depressive disorder due to another medical condition. It can be then further categorized into peripartum onset, maybe a seasonal pattern, melancholic features with mood congruent or mood incongruent psychotic features, and anxious distress, as well as catatonia. When we look at the pathophysiology of major depressive disorder, we understand that the underlying pathophysiology is not really clearly defined yet. There's current evidence that points to a complex interaction between neurotransmitter availability and receptor regulation and sensitivity underlying the affective symptoms. So clinical and preclinical trials actually suggest a disturbance in central nervous system serotonin activity as an important factor. However, drugs that produce only an acute rise in neurotransmitter availability, such as cocaine or amphetamines, do not have the efficacy over time that antidepressants do. So, which signs and symptoms must be present to meet the diagnostic criteria for major depressive disorder or clinical depression? Among the criteria for a major depressive disorder is at least 5 of the following symptoms have to be present during the same 2-week period, and at least one of the symptoms must be diminished interest or pleasure or depressed mood. Others may include significant weight changes, sleep disturbances, psychomotor agitation or retardation, fatigue, or feeling of loss of energy, feeling of worthlessness, diminished ability to think or concentrate, recurrent thoughts of death, and recurrent suicidal ideation without a specific plan, or suicidal attempt or specific plan for committing suicide. So, which screening instruments may be used in clinical depression or major depressive disorder? There are a few screening instruments, and one includes the self-report screening instrument for depression, which are the patient health questionnaire, and a 9-item depression scale. Each item is scored from 0 to 3, providing a severity score. The Back Depression Inventory, or BDI, the Zung Self-Rating Depression Scale, as well as the Center for Epidemiologic Studies Depression Scale, which is a 20-item instrument that allows patients to evaluate their feelings, behavior, and outlook from previous week. Depression is a clinical diagnosis and based on history and physical findings generally, so there's no diagnostic lab tests that are available by far to diagnose major depressive disorder, but focused lab studies may be useful to exclude potential medical illnesses that may be present as a major depressive disorder. And these are full blood count, your thyroid stimulating hormone or thyroid function test, vitamin B12, a rapid plasma reagent, HIV, biochemistry panel, blood alcohol levels, a blood gas, probably a dexamethasone suppression test, or a co-syntropin or ACTH stimulation test. Now, what do functional neuroimaging findings reveal about the pathogenesis of major depressive disorder? Here we have neuroimagings that can help us clarify the nature of the neurologic illness, a PET scan which has an effect on the receptors, an ECT which can be an effective treatment in certain conditions, CT scans and MRI of the brain which looks at any organic brain syndrome or hypopituitarism, as well as SPECT scan which shows regional blood flow deficits through this modality. In all patient populations, the combination of medication and psychotherapy generally provides the quickest and most sustained response. So there are a number of evidence-based psychotherapeutic treatments for adults with major depressive disorder, and these include behavioral therapies, cognitive behavioral therapies, interpersonal psychotherapies, problem-solving therapies, and self-management or self-control therapy. So in summary, major depressive disorders are mental health diseases that is characterized by pervasive low mood. You'll need to understand the classifications and the subcategories of these disorders, what are the risk factors, causes, and pathophysiology, as well as, most importantly, identifying the signs and symptoms, and then channeling the patient for treatment, which can be a combination of medication as well as psychotherapy. So we have come to the end of this session. Thank you.